So welcome everyone. Did you want to start, Caitlin, and then we'll go into the land acknowledgement?
I'm happy for you to start with the land acknowledgement, and then I would be privileged to introduce Pamela and Grouse.
Great. So we will start there. Welcome everyone today. So before we start, I just want to recognize and acknowledge that we're collectively gathered on the traditional, ancestral, and unceded territories of the 7 Interior Region First Nations. This region is also home to 15 chartered Métis communities, and it's with humility that we continue to strengthen our relationships with First Nation, Métis, and Inuit peoples across the interior. I am personally calling in from the unceded territory of the Syilx Nation here in Kelowna, BC, and I encourage you to acknowledge where you're calling in from in the chat if that's something you'd like to do. And I'll pass it back to the host, Caitlin.
Thank you, Amy. We are very privileged today to welcome Pamela and Wilfred Grouse Barnes. They are both Syilx elders and knowledge keepers to do a welcome today, and so that we have the opportunity to continue to learn from them. So thank you very much for being here today, you two. Actually, you three.
Thank you. So my name is Pamela Barnes. My ancestral name is Chuchuwasket, which means the coming of a storm or the coming of change. And we do have our great-grandson with us this afternoon. And so I want to first, I have the privilege of welcoming you to our traditional territory, which I will do in a moment. And then Grouse is going to open up the meeting in a good way. Okay, you gotta be quiet, remember? And so I first want to thank you for the land acknowledgement. And I'm going to take a moment to explain the difference between a land acknowledgement and being welcomed to our traditional territory, because those are two very important protocols, but they are different. A land acknowledgement is recognizing, in this case, we're coming in from West Bank, recognizing the Syilx people as your host. Irregardless of whether or not you've learned history in a way that you understand that we are your host, it's irrelevant, because the facts are that we as Syilx people, we have never sold, traded, or given away our lands. We have never negotiated or signed anything or given up any of our jurisdiction. So under Canadian law, none of this has ever been legally transferred. And so it's important for all Canadians and all peoples coming to these lands to now understand that. And so a land acknowledgement is recognizing that we are your host. We're often asked to come and do land acknowledgements. And I have to say, it's kind of awkward, because it's like being invited to your neighbors for dinner. You don't ask your neighbor to recognize themselves as the host and thank themselves. That is the responsibility of the guest. And so it's appropriate for all of us, when we're not in our own lands anywhere in this country, that we recognize the First Nation that we are, whose land we are on. In this case, that's the Syilx people for this part, for this area where we're zooming in from. So that's what a land acknowledgement is. And so again, I would also encourage you, if you're coming in from other places other than the Syilx territory, then it would be important for you to know what nation and to do that acknowledgement. And there's resources out there to help you if you don't know. Now, in terms of welcoming you to our traditional territory, I first want you to understand it's not a casual thing. Being welcomed to our traditional territory is a very important protocol, and I want you to understand what our lands mean to us. Our lands are made up of the blood and the bones of our ancestors for thousands and thousands and thousands of years. It is all sacred to us, not just one place here and another place over there. All of it is. When we're out on the land, we recognize that we are literally walking on the blood and the bones of our ancestors. And we have that reverence, just like you might if you were in a cemetery. In our teachings, we are reminded that any one of us is only here but a moment in time. So our relationship to these lands is more like one that is borrowed from future generations. And that's very different than the concept of human ownership of land, which is something that has come to be in the last 200 years since peoples have come here from other places. To illustrate the difference between these concepts, I use this necklace. If I own this necklace, I can sell it, trade it, give it away. It's mine. I can do what I want. I can take really good care of it, or I can toss it aside. It's mine. I can do what I want. But the moment that I borrow this, everything about that relationship changes. I cannot sell it or trade it or give it away. It is not mine to do that with. And even more importantly, there's an expectation that I take the best care that I possibly can. And that when I return it or leave it, it's at least in the same condition as I found it. So it's with this deep understanding of our sacred responsibility to these lands and waters and all of the life that it contains that we first welcomed others, even though they were not invited. And it's with this deep understanding of these responsibilities that today I welcome you to the traditional unceded and currently occupied territory of the Syilx people, with the hope that we all get back to doing a better job of caring for the land, the water, all the life it contains, for all of our children, our grandchildren, our great-grandchildren. So welcome. Thank you. Ralph?
Why, Lemon is quite getting them down the questions. Can tell Stickat Kootenays. My ancestral name is literally means bumped by sister-in-law. And there's a long story behind that. A good story. I'm going to say a little prayer so we can get started in a good way. Why, Lemon Cool and Chutin Kan wished. Tali Hastis Boos can a latus near Kain. Agats Kalquiltum Stamapanas Kalkalt. Tali Hastkaliayat sweet. Ik eet hem goed. Tali Hachakal menimsted. Ik Leko Itskin will cook our stickum to Yayatstem. But it's schools to make it hula. Kwahina Kula mented. Why limnum kulunjut, why caps timis kailsted. Thank you, Creator, for allowing me to say a few words and a little prayer. You know, the things we do on the land, we still do. We still gather berries, we still gather roots, and we still gather medicines, as well as we go hunting and fishing on our land. We've been doing that for thousands of years, and we're still working our land. This land is beautiful. We work and play on this land. So welcome to Syilx territory, and let's get on with what we're going to do today and enjoy each other's company. Limlim, thank you.
Thank you.
Thank you very much to both of you. And Jackson, we appreciate you being here to start this meeting off in a good way. So thank you very much for your continued teachings and your ability to help us to understand and to hopefully follow in your footsteps. So thank you very much. Thank you. Amy, I think I'll get started then with just a couple housekeeping or items for you to be aware of. So we are recording today's session. It will be used online. We will share this resource after today with others through a resource website. We'll also share it through Interior Health's resources. We've also posted in the chat, you'll see 3 different files that is the translated versions of this presentation. So it is available in Ukrainian, in Dari, and in Arabic. So please feel free to click on the link if it is easier for you to follow along in your mother tongue, and you can download that file. You click on it, you download it, save it, and then you click on the link again and it will open for you. We'll also have these available on our resource site at the end of today's presentation. If you have a question as we go through the presentation today, please feel free to put it in the chat. You can ask your questions in English, in Ukrainian, Russian, Dari, or Arabic, and we will do our best to respond to those throughout the presentation. If there are any additional questions left over at the end of the presentation, if we haven't had a chance to get to you, please know that we will respond. We'll make sure that the answers to those questions are included on the website with the resources. We will be posting the presentations in all of the 4 different languages on www.kcr.ca/RRT for Refugee Response Team. And we also will be entering a survey there later as well. So if you're able to go and give some feedback, we would be very thankful for that. But all of these resources will be made available on that website, as well as through Interior Health's website. All right. Next, please. So I'd like to just do a quick introduction on the Refugee Response Team. So that you understand a little bit more about the project and the funding that we've received. So when war broke out both in Afghanistan and the Ukraine, the government of Canada committed to support Afghan refugees and displaced persons from the Ukraine to come to Canada as quickly and safely as possible. To support these efforts and assist the settlement of the Afghani refugees and displaced Ukrainians, the province of British Columbia created the Refugee Readiness Fund. And from that, the Refugee Response Team network through the Ministry of Municipal Affairs. So the Refugee Response Team for the Thompson-Okanagan and Kootenays, which is who we are, primarily includes the 6 cities and surrounding areas of Kamloops, Vernon, Salmon Arm, Kelowna, Penticton, and of course the Kootenays. The collective group includes team members from settlement service organizations in the region that have come together to effectively address settlement issues at the regional level. After a series of in-depth community roundtable meetings and stakeholder consultations in each city, input was gathered on gaps and short-term needs in order for successful settlement of newcomers, including those from Afghanistan and those from the Ukraine in the Thompson-Okanagan and Kootenays region. So the Refugee Response Team identified and prioritized 7 issues that needed to be addressed to meet the needs of these newcomers, as well as to support the communities that are welcoming them. So the team developed actions to best address the critical needs of short-term housing, safety checks, creative long-term housing solutions, training for paid and volunteer translators and interpreters, information and resource sharing, summer programming resources for school-aged children, volunteer coordination and support for cultural organizations, and improved trust and understanding of healthcare services and programming. It's very important to Interior Health and the settlement service providers in the region that we ensure that all newcomers have access to and feel comfortable accessing both physical and mental health supports and services. And so that's why we're here today, to share some information about what is available in the community and how to best access that. I'd just like to introduce and thank the RRT partners. So the Columbia Basin Alliance for Literacy, the Shuswap Immigrant Services Society, Vernon and District Immigrant and Community Services Society, South Okanagan Immigrant and Community Services, and Kamloops Immigrant Services. So thank you to our partners through this work. We're very appreciative and couldn't do it without you. So thank you. Next. And one more, please. So today we'll be talking about access to health services for those who have come through the government-assisted refugee stream of immigration. We will also be talking about those who are considered temporarily displaced persons from the Ukraine. And then also lastly, those that are privately sponsored coming through the refugee system as well. So I'll start off with those that are that come through the government-assisted refugee stream. So they receive support through the Resettlement Assistance Program, or affectionately known as RAP, for up to 1 year from the date that they have arrived in Canada or until they're able to support themselves. So typically when someone arrives through this immigration stream, they would come with something that is called Interim Federal Health. So they would have been signed up for this program. They would be able to access this health services in order, or this sort of insurance in order to be able to access health services upon their arrival. They also are eligible to apply for MSP, the Medical Services Plan, which we'll talk about a little bit further in the presentation. And so this gives them access to both of those for the time period in which they are being sponsored by the government. Later on, at the 1 year mark, then they would be eligible just for MSP only. Any settlement serving agency or possibly a community group could also support to help apply for these coverages as required. Next, please. Great. So those that have come as temporarily displaced persons, primarily from the Ukraine, are individuals and families arriving in BC under potentially the Canada-Ukraine Authorization for Emergency Travel, or QET, are temporary residents when they come to Canada, and they are eligible to apply for MSP, or Medical Services Plan. They're required to provide their proof of residency, so the temporary resident visa or a visitor permit issued through QET, or should they have a work permit, study permit, Canadian citizenship, or a permanent resident document. When these individuals or families arrive, they can apply immediately. They're eligible for MSP as soon as they arrive. And again, if they need any support, any of the settlement serving agencies or people that are working in the community would be more than happy to support them in completing that application. Next, please. So lastly is the privately sponsored refugees. So these are individuals who come again through the refugee immigration stream. And they receive support directly from groups of Canadians. It could be through a variety of different groups. And those individuals volunteer to help these permanent residents adjust to their life in Canada. They will also support them financially for a one-year period after their arrival. As with the government-assisted refugees, these individuals and families typically are coming to Canada, and at the time of their immigration, they have already been enrolled in the Interim Federal Health program. And then once they arrive, they would be eligible to apply for MSP. And it is
要到2点半，从现在到2点半。哎呦，
and it is
刚给你
this,
发过去了，试一下。对，Team， 点一下那个 Zoom link， 看一下。
let's just mute. There we go. Sorry about that. So they also would be eligible to apply for the MSP. And then it would be up to the sponsors to work together with them to help to access healthcare as required, and possibly we know it's difficult in our communities across the region to find a family doctor. Next, please. So I just wanted to talk a little bit about settlement services. So all of those partner agencies that we have spoke about offer settlement supports across the region. And so there is one-to-one as well as group programming that may include things such as access to healthcare, which we're talking about today, any childcare resources or availability in the community. They support looking for employment, housing options, English classes, and any other community supports that may be needed. They will provide information on legal rights and responsibilities, opportunities to connect within the community, whether it's with different organizations or individuals, say through a mentorship program. There's also typically youth programming, as well as the resettlement assistance program, which we talked about a little bit earlier. This is the program that supports those individuals that are coming through the government assisted refugee stream when they first settle here in Canada. Just to get some of their basic needs cared for as they are making Canada their home. And last but not least, translation and interpretation supports, which we're seeing can be of great assistance to those coming to Canada. Next, please. These are the partners in which we discussed a moment ago. So Columbia Basin Alliance for Literacy covers 16 different cities in the Kootenays. The Shuswap Immigrant Services Society is located in Salmon Arm. Vernon and District Immigrant and Community Services, it's a giveaway. It was located in Vernon. The South Okanagan Immigrant and Community Services is located in Penticton. They cover Summerland, Oliver, and Osoyoos as well. Kamloops Immigrant Services is for the Kamloops and the Thompson-Nicola region. And then ourselves, KCR Community Resources, we cover the Central Okanagan, including Kelowna, Lake Country, West Kelowna, and Peachland. We will share the links to each of these organizations at the end of our presentation. So if you wish to reach out to any of them, please do so and see if there's something that they can support you with. Great, next.
Thanks, Caitlin.
Thank you.
Hi, everyone. My name is Amy, and I have the privilege of co-hosting with Caitlin today. And I just, first of all, want to acknowledge gratitude to all of my colleagues from across the region who and the area who came together very quickly to support this project. I think you'll probably learn a lot today, and I know everyone will also appreciate your input. So you'll be hearing from a lot of subject matter experts today, and the goal today is really just to overview what to kind of expect when you're interacting with the healthcare system in BC and in the interior region. We're going to go over some specific areas or programs, including primary care, urgent care and emergency services, public health, mental health and substance use, specialized services, home health, healthy from the start. We're actually not going to go over healthy schools, healthy from the start, and we're going to review some dental and vision care options, and then some general resources as well that you can review on your own. So that's so again, encourage you to ask questions and if you need clarity. So we can move on. Before we start, we just want to acknowledge that Interior Health is committed to providing an environment that is culturally safe. Interior Health believes that everyone has the right to work and receive health care that and services in an environment that is anti-racist and values diversity, inclusion, and equity. That is an excerpt from a longer anti-racism policy that we all have access to. And there's a link there at the bottom called the Patient Care Quality Office. And you can hop on that link and explore that as well. And if you do have a situation where you'd like to provide feedback, you can do so in that manner. Next. So what is healthcare like in BC? So I think as Caitlin overviewed, healthcare is a free and public service in BC through the Medical Service Plan or MSP program. It pays for basic medically required health services. That includes doctor visits, medical tests, and treatments. However, not all health costs are covered by MSP. For example, you may have to pay for a dentist, optometrists or eyeglasses and things, physiotherapy and paramedical services, and even prescriptions yourself. So just to be aware and always ask those questions. Again, its eligibility is BC residents or Canadian citizens or permanent residents, government-assisted refugees, or those with a valid visa, and international students with study permits as well. Yeah, just some further expectations. So in Canada and in BC, there's a variety of medical professionals that may be involved in your care, depending on the concern you have. These may include nurses, physiotherapists, health navigators, or social workers. And we're just here to help and support you. We are here to focus on, of course, treating illness and injury, but also we're here to talk to you about illness prevention, wellness, how to live a healthy lifestyle. So it's sort of that continuum of care. Your practitioner may ask about your physical health during a visit. They may ask about your emotional or mental health and your health history. So your healthcare team may include a doctor or a nurse practitioner as a primary care provider. It may include a nurse, a social worker, or a mental health clinician, and a physio or dietitian or some of these other clinicians as well. So we really work in a team-based approach. So you may see any one of those team members during a visit. Next. These are just some tips on how to prepare for a medical appointment, to have a good appointment. In almost every center, you'll want to check in first, whether that's the emergency room or a family doctor. There's usually an office assistant there to help you. We'll take your name and insurance and things like that. Number two is really important. It may be important for you to bring a support person. Just in general for support, if needed, somebody that can translate your language as well. Interior Health sites can also arrange Provincial Language Services for you. And it's important to note that upon check-in, especially when you're entering, say, an urgent care center or an emergency room, it's important to give us some time to arrange that. If you have a pre-booked appointment, it will be good to work with that practitioner and let them know that Provincial Language Services are needed. We'll go into that in another slide in detail. We try to be on time in healthcare, but sometimes you may have to wait depending on the center or what's going on that day, especially in an urgent care center or an emergency room. Wait times are longer than, say, primary care visits. So just to be aware of that. If it's a first-time visit, it's important to bring in medical history or any reports you have, any medications that you're taking, and of course, your MSP or interim funding numbers. So those are important for us. Your health provider may also decide to refer you to other services. So while you may talk to a doctor or a nurse, at a center, they may refer you to, say, a lab for blood work or a specialist or elsewhere. So if you're unsure about that, just ask those questions, and we're happy to help you navigate that. Being on time is important. We talked about a schedule in a day. You know, if you have a pre-booked appointment, it's appreciated for us to stay on schedule. Thank you. Next slide. So yeah, this is just, I wanted to spend some time sharing the information around Provincial Language Services. So it's a funded service that reduces language barriers and enables access to information. So when we're talking about medical information, you're going to want to receive and share that information in your language. It's important to have that clarity when we're talking about our health. So Provincial Language Services, actually, the last time it's over 200 languages that they can translate and interpret in. They provide written translations, in-person service, over the phone, and virtual. And again, Interior Health will provide that service. So communicating that with us is important if you need that. Okay, I think that's good for now. So for the next few slides, you're going to hear from all of the subject matter or program leaders in each area. So sometimes figuring out where to access care is a challenge. It's still a challenge for all of us as well. So hopefully by the end of these slides, you'll be able to make better decisions about where to access care. So for the next few slides, we're going to talk about primary care, urgent care, and then emergency care. And I'm going to pass the next slide over to Luke.
Thank you, Amy. Hello, everyone. I'm Luke Primage. I am the manager of primary care services within the Central Okanagan, and I work with Interior Health. I'm quite fortunate in being able to work with many of the folks who you'll be hearing from today, specifically with Caitlin and Sabrina and their team with KCR. Over the last 2 years, we've been able to forge some great relationships between each other. So I'll give you an overview of what primary care services are within the Interior Health and what you can expect. Next slide, please. Primary care is best understood as your first point of contact into the healthcare system normally. This is when you arrive at a traditional doctor's office and you're waiting to see a doctor for any of your healthcare needs. You need medications, you're not feeling well, you've had a cold for a long period of time. Typically, this is what primary care services encompasses. And usually, as I mentioned, is that your first point of contact into our larger healthcare system. The tip, Amy touched on this a little bit earlier. In primary care, this includes a team of clinicians or professionals, healthcare professionals that may work with you on a variety of different reasons for why you're accessing that care. You may meet with your doctor or a nurse practitioner who will ask you to talk to another clinician based on what your needs are at that point in time. They may ask you to speak with a nurse about your chronic illness, or speak with a dietitian about your eating habits and physical abilities. A lot of times we have available and include social workers who will help navigate folks through the healthcare system, but also to help link you to other community resources that may be needed in the event that you're seeking care and at your appointment. Other expectations you can have when you are accessing primary care is you can be expected to have a health check by one of these clinicians, the doctor or nurse, and you'll be asked several questions about your health and how your family's doing, and just to get a better picture of who you are and a better understanding of what your needs may be at that point, so we can provide you better services and the right services. Some of you may have heard of Rutland Aurora Health Center. It's an interior health operated clinic in the Rutland community. It is usually a first point of contact for folks that are accessing KCR services. And we have a very close relationship with KCR because of this reason. And Rutland Aurora Health Center has a team that I just talked about. There's a family doctor, there's nurse practitioners, social workers, and nurses right on site and right on staff, ready and able to meet your needs and help and work with you. The Rutland Aurora Health Center, like all of the interior health programs, continuously works towards providing culturally safe care, and is a primary medical care
This is for Heather.
office, and will link and provide behavioral and mental health supports as well. And as Amy mentioned, there are translation services available at our sites, and you can expect to be followed up by the team at a clinic like Rutland Aurora Health Center, which there are many others within our community. Next slide, please. What we've tried to do working with KCR and our other partners is provide a visual map of how to access services in the Central Okanagan. And this, what you're seeing here, is an English version as well as a translated version into Arabic, and using pictures and words to help folks understand where they can access service and when they should be accessing service. So if you look at the top left of the visual, there's happy faces and it says Primary Healthcare Center. Again, this is your first point of contact when you're first trying to meet a doctor or a nurse for your healthcare needs, and explains you would be accessing a primary health center for new or ongoing health concerns. If you're not feeling well, you need medications or wellness checks with your young ones or your family members or yourself. Rutland Aurora Health Center is an example of one of those primary healthcare centers, which there are several of in Central Okanagan. And then the list goes down from basically the type of need of healthcare that you're looking for. And it explains, if you can't get in at a primary health center, we have an 811 number that people can call and receive assistance in helping to find a primary healthcare center and helping out with their issue at that point in time. It explains how to use and access urgent care and the urgent care centers that are within our communities, and when it's appropriate to seek care at those facilities. And the same for the emergency departments at the hospital. We help identify when it's appropriate to seek care. If we say when it's appropriate, because if you're seeking care in the wrong place, you may end up waiting a very long time and not getting the care that you're looking for at that, or the service that you're looking for at that point in time. So that's why we've tried to make it, help people understand where to go for what services they're looking for. Next slide. Within, there's, outside of the primary healthcare centers that I've talked about, there are also ways for folks to try and access doctors or nurse practitioners or healthcare providers, and the different ways and throughout the interior health region is to look at the Health Connect registry and register yourselves within there outside of the Central Okanagan, and use that as a means to get connected to healthcare services and a primary care provider, which could be a physician or a nurse practitioner. Other means to look for healthcare services are through Pathways Medical Directory, which we've provided another web link for you here, which provides a lot of information to different resources that are available in each of the communities. And then specific to the Central Okanagan, we have a family doctor program where a new person to the community who does not have a doctor or nurse practitioner that they're working with can register on and apply to be connected to a family physician or nurse practitioner within the Central Okanagan. And again, to some comments made earlier, there are wait lists. So we like to provide people the information that this isn't an instantaneous process. There's a lengthy wait list process to that for the entire region. And that concludes my information on primary care services. I'm happy to have my name be left as a contact and work with whomever on more information. Thank you for your time.
Thank you, Luke. That was excellent. Caitlin, would you like to pause for questions in between, or should we just go with the flow? And if they pop up in chat, we can pause then?
Yeah, I think I'd like to encourage people to ask questions. I think as we're going through the presentation, if you have a question for that speaker, please feel free to put it into the chat. We'd really love to hear from you. It's a great time to have your questions answered. Obviously not your personal questions, but bigger picture questions. And then if you want to do that as we go, that would be great. But otherwise, if there are no questions, then I guess we'll continue.
Great, thanks for that clarity. We're going to shift now to talk a little bit more about urgent and primary care, and I want to welcome Emma Banyard, who will run us through this area and also when to use the emergency room. So really important stuff here. So welcome, Emma.
Thanks, Amy. Thank you, everyone, for having me. I'm super excited to be here. I'd like to acknowledge that I'm joining from the Syilx territory today here in so-called Kelowna. It's been really nice to hear how much the team aspect of healthcare in Canada is being acknowledged today. That is, I think, one thing that we do really well is that your care is managed by a team, and a team full of so much knowledge to share, which is fantastic. So sometimes you may not have access to a specific provider for family care and your whole kind of primary care realm. So patients in Canada are typically attached to a primary care provider, but then they can also access care outside of that regular primary care provider. If one, they don't have the time frame in which you need to access that care is not met by your usual provider, or you don't have a usual provider at all. So a relatively new initiative here in the province are what's called urgent and primary care centers. So these centers provide access to same-day, urgent, and non-emergency healthcare. These centers are often open for extended hours, so beyond what you would get at a typical primary care clinic. That includes during the day as usual, but also evenings, weekends, and holidays. Each urgent and primary care center, and I'll refer to them as UPCCs, that's the common acronym that we use for that type of clinic here. They vary depending on the clinic. So one thing that these clinics do is they're built to suit the community that they're put in. So each UPCC might offer slightly different services or a slightly different team, as well as a slightly different access model depending on what that community needed. But for the most part, they all provide similar care. Currently, we have 8 UPCCs in Interior Health, and they're pretty well spread across the Interior Health region. Here in the Central Okanagan, we have the Kelowna UPCC, which is pictured there, the West Kelowna UPCC just across the bridge. There's also one in Penticton and Vernon, and then kind of going further from those central hubs. Oh, and I'm just realizing I forgot Kamloops in that list, but Kamloops is also a UPCC site there in Cranbrook, Castlegar, and our newest in Ashcroft. We can go to the next slide. So the types of things that you can access an urgent and primary care center for are quite similar to what you can access your regular primary care provider for, but it's a time frame difference. So typically, urgent care centers are reserved for care needs that need to be met within 12 to 24 hours. Some examples of things that you might access a UPCC for are things like minor pain, like your sore throats, an earache, minor injuries, like you may have rolled your ankle while you were out hiking in the wonderful hills of the Okanagan here, but it's just a minor strain, or you maybe accidentally scraped yourself on the bike while you were riding along our rail trail. Those are things that we can help you address at the UPCC. Some minor infections like respiratory infections or kind of upset stomachs. And we also have a team to support with mental health as well. So if you have questions about mental health or you need help navigating a system, most of our sites have social workers, which can help do that as well. And then we can also address sexual and reproductive health too. We often refer in primary care that we provide care across the lifespan of your kind of getting old, you're growing up, you're all levels of life we can care for. Again, that's provided by that team of care providers. So a UPCC, you may not actually end up seeing a doctor or a nurse practitioner during your visit, but one thing that you can almost guarantee is that you'll come into contact with a nurse who will help you navigate your visit at the UPCC. So if you're somebody who is not sure of whether or not a UPCC is the best place for you to receive that care, or if you're accessing it for the right reasons, a nurse will usually be your first touch point of care, and they will help you navigate that. So I think never be afraid to access one of these centers. Everyone will welcome you and will help you navigate and ensure that you're in the right place and receiving the right care at that right time by that right person. Most of the UPCCs, you can call them, or if there's language barriers, which are common in these types of situations, you can also just walk into any of these centers. And again, they'll help you make sure that you understand how to access. The Provincial Language Services has been mentioned by Amy previously, and this is available in all UPCCs as well. So if that's something that is required for your visit or one of our team members identified, it's something that you can access. Amy, I see your hand up there.
Thanks, Emma. There's just a question in the chat that's right on
sure.
this topic, so I thought we could go there. So the question is exactly what you're kind of explaining, but could you walk us through that? So could you please let me know if we can use the Provincial Language Service phone number that you mentioned in before going to an urgent care visit with a client? So what's the process if I want to see your I need to go to urgent care and I need a provincial language service?
Yeah, so the Provincial Language Service for the most part is reserved for access by the care providers. So they would connect to that Provincial Language Service to assist you in your visit. So I'll maybe walk through a quick example of what it might look like if you were to present to an urgent care center and required a provincial language service. So if I were somebody who was not English speaking and I needed to go to the Kelowna UPCC, so I would show up right at the front door to the urgent care center there. I would be greeted by what we call a patient ambassador who would provide me a mask and some hand sanitizer. And at that point, we might be able to identify that there's a language barrier there and that we don't speak the same language. So that patient ambassador at that time would do their best to direct you up to the front desk to speak with the medical office assistant, and the medical office assistant at that time has a choice to access the provincial language service by calling them right then and there. It's immediate access. They just call a hotline, put in some information, and then we're connected with a translator right away. At that point, information would be shared. It sometimes is done on an app too. We also have access to an app that can provide kind of limited translation for the purposes of registration. And then after we get the necessary information about who you are and maybe why you're here, that care would be transferred to a nurse who would again have access to that provincial phone line and would call and likely would put a phone on speakerphone where you and the nurse and the translator are almost in a triangular kind of conversation of where you would be speaking on speakerphone to the Provincial Language Services to explain your health concern. The translator would translate it back through speakerphone so that you can hear it and the nurse can hear it. And then the nurse would speak back to that translator who would then translate it for you. That same process would be repeated for any other healthcare provider that comes in your visit journey. It's something that should be offered, and we encourage to be offered for any patient with any kind of language barrier at all. I hope that answers the question.
Thank you, Emma.
Yeah, I see in the chat too that PLS is it available for any doctor's appointments? Luke might be able to touch on that a little bit too, but I know at least for urgent and primary care centers, as well as emergency departments, Interior Health has access at all of those sites. But sorry for putting you on the spot, Luke, but I'm not totally sure if that's automatically set up in all of our other primary care clinics.
Yeah, no, good question. Sorry, good question, Emma. It is available. The PLS services are available in all the primary care sites in the Central Okanagan, including private family practices, private family doctor offices. Where there is a barrier is with specialist and specialty type services. And there seems to be a bit of a barrier when maybe going to a cardiologist appointment or those type of more special type care. But certainly any primary care doctor's office, you can access, or they will be able to provide the patient language services.
Thanks, Luke. Okay. That's all I have for urgent and primary care centers. I'll pause here again if there's any other questions about what exactly a UPCC can offer you.
Sorry, I guess I raised my hand. Yeah, so my name is Min. Yes, I actually work for Canada's Immigrant Services as a settlement counselor. So I have something related that I don't know if it's proper to ask right now. But we were just wondering if Interior Health or who can we approach to be able to host a workshop for the newcomers regarding like spider bites or poisonous snakes in terms of prevention and the treatment, right? We want to know what organization can we approach to, because we really have lots of temporary foreign workers and newcomers that they come to Kamloops, this area, or the cities surrounding us for work, and they're not familiar with. And even us, it's good training for staff to know how to guide our newcomers in that regards.
That's a great question. I think I would lean probably on our promotion partners, our health promotion partners in the kind of public health world. And Amy, I don't know if you have anything to add, but depending on the area, I would think Kamloops, the public health team, would probably be involved with a lot of that work and might be a resource that you can reach out to.
Yeah, I would agree. Population health or public health. So you could probably go to our Interior Health website and search that. Do we have anyone from Pop Health on the call that could speak to that? And if not, that's okay. We can circle back to that one.
Hi, this is Virginia. I'm in public health in Kelowna, so I can't speak to Kamloops specifically, but this does sound like something that public health could support. So I would reach out to the public health unit and ask to speak with one of the nurses, and they can bring that to their team.
Okay, wonderful. Thank you for that. I will contact them. Thank you.
Amy,
Thank you. Sorry,
Did
trying
you-
to type and post at
No
the same
problem.
time.
Amy, we also had a little bit earlier, we had a question. Is there a plan to approve another health clinic for primary care other than Rutland, Aurora, and Kelowna due to the high load they have and long waiting list?
Yeah, I think I answered that one as well.
Oh, did you?
So,
I'm so sorry.
That's okay. I'm doing my best too. So there's not plans to open another clinic. There may be some plans to extend the hours at Rutland Aurora Health Center in 2023. That's why we're reviewing these other services like urgent primary care, which does provide, longitudinal and primary urgent care access, and there may be opportunity to attach to a provider there, or the Find a Family Doctor program. Those are the ways to get connected to a family doctor. Just to give perspective, I think Luke mentioned there's probably 50,000 people in the Central Okanagan alone that don't have a family doctor and are looking to get attached. So that's why we're overviewing all of these resources. And I'm just going to add this question, Caitlin, that just came in. I do have, I'm registered at the Rutland Aurora Clinic. Can we still apply for a family doctor? So Luke, I wonder if you could walk them through that. So are they attached to a family doctor at Rutland Aurora permanently? Do we still apply for a family doctor if we're attached to RAC?
Yeah, if a person is registered and attached to a provider at Rutland Aurora Health Center, you won't be able to apply on through the Find a Family Doctor program, because that person will show up as already currently attached to a provider. If there's, for whatever reasons, a need to be detached or moved to a different provider, the first step is to have that conversation with the current provider that you're working with, or the team that they're surrounded with. In this case, Rutland Aurora Health Center has a team, the social workers and the nurses, that could assist with that conversation. We really want to encourage conversations and work between patients, ourselves, and the providers they're working with, because they also may have other suggestions that might be more appropriate. And removing yourself from being attached to a provider will put you in that very large queue that Amy just explained, of upwards of 50,000 other people seeking to be attached to a provider in the community.
We have a hand up and then another question in the chat we can answer, and then we can continue on.
I'm the one asked the question about Rutland Aurora, because I have some participants have been waiting for a year to be assigned to a family doctor in the Rutland Aurora, and they didn't, and they go to the urgent primary care to address their needs. And the thing is, in the urgent primary care, they have been told that they need to be followed up by a family doctor, because they need continuous following up because of their medical status. So that's why I'm raising this concern, that there are more participants in this situation. Thank you.
I so appreciate you raising that concern, Tirania. It's definitely something that, particularly in Kelowna, we see a large population of folks without a family doctor who are waiting to be connected to those resources. One thing I will say is that a UPCC in most circumstances would never refuse care to anyone. So despite having maybe identifying like the best course of care to be followed up by somebody who is able to continue on a relationship with the patient, those individuals can still always continue to come back to the UPCC. They just may be seen by a different provider every time, which makes care a little bit difficult, right, in terms of continuity. So we always try to encourage folks to, one, make sure that they're signed up for the Find a Family Provider program, and that they are able to help us identify if they are attached. So that's another thing, is communication of when those individuals do become attached somewhere, so that we can adequately transfer care over there in terms of continuity. But we're in a healthcare environment right now where it's incredibly difficult to find a family physician. I see in the chat there that there was somebody made a comment and a question about finding a family doctor and the amount of time that they've been on that wait list. I think that individual noted that after about 10 months or a year, they still haven't been contacted. And unfortunately, that's fairly normal for the environment that we're in right now. Hence why these UPCCs primarily provide care to those unattached patients, because they don't have anywhere else to go. We've got a large portion where you don't have a family provider. So they're trying to fill that gap in providers by having this as an access point to care.
Thanks, Emma. I think you explained that well. So in our Coles Notes version of that, a condensed version of that is that if you will not be denied care at an UPCC. You're temporarily attached. You can be temporarily attached to that UPCC until you find a family doctor. We will do everything we can to help you find a family doctor if you present at a UPCC. So they are absolutely valuable assets to our community, these urgent and primary care centers. And I wish things were different. I think I saw some latest stats provincially, over 1 million people without a family doctor. So that just translates to us locally. And so, yeah, that's why these resources we're going over today are really important. So thank you, Emma, for your overview of that. And hopefully you can stick around, because I do think urgent care centers get a lot of questions, and
Totally.
you're the best expert to answer that. So,
Yeah, I'm happy
right
to.
on.
I think this is a good segue into the conversation too of appropriate use of resources in our community, and ensuring that that not only newcomers to Canada, but the general population understands where the best place is to receive care. So the next piece that we'll talk about is that emergency care. So if we can move on to that section now. So emergency care, this is when you think of, there's many names. Like I would think that emergency care, there's the emergency department, emergency room, the ER, the ED, we call it lots of things, but its primary purpose is to care for individuals who are having an emergency. They care anything that is life-threatening, whether it's injury or illness. This is what you would go to an emergency department for. So unfortunately, because of the kind of gaps in the healthcare system currently, or the human resource gap, is some folks end up in the emergency department inappropriately for things that are not actually an emergency. And this creates a little bit of a backlog on our emergency system. So to quickly highlight, some of the things that you would always go to the emergency department for are things like a major accident. Like if you got into a car accident and you required medical care after a car accident, typically the best place for you to go is the emergency department. Or if you have a loved one who tells you that all of a sudden their chest starts to hurt and they've got a really big heaviness or chest pain, or they've got trouble breathing, or all of a sudden they've gotten really weak, or they've fainted and lost consciousness, or as a result of an accident or an injury, they are heavily bleeding. All of those types of things would constitute an emergency and are absolutely appropriate for the emergency department. Any of those presentations are likely not appropriate for your family provider's office or a UPCC in some circumstances, mostly because those areas do not have the resources available to provide the care that you would need in that situation. In those emergency situations, it's also sometimes not the best idea for you to try to get yourself there. So 911 is always something that you can rely on if you need assistance to get care for that emergency that you're experiencing. And 911 will help make a decision on what the best way to get you that care is, whether or not it's sending an ambulance or it's sending a team to your house to provide an assessment in your house. 911 is your go-to call if you feel like you can't safely get yourself to the emergency department. Most emergency departments are available 24 hours a day, 365 days a year. So that's emergency care provided around the clock every day. Our big hospitals in the interior are the Kelowna General Hospital. We've got the Vernon Jubilee Hospital, the Royal Inland Hospital in Kamloops, and then the Penticton Hospital. There's also a large hospital in Cranbrook, and then I've listed the other few sites that have hospitals in our smaller communities. One thing you might come across in these smaller communities is that they may not always be 24 hours a day. They may have periods of time where they're closed, whether it's overnight or on certain days of the week. And by nature of the healthcare environment, they might be closed due to staffing shortages. But regardless, you can always call 911 and they would be able to direct you to the most appropriate place to receive care or send an ambulance your way to assist you. Again, the Provincial Language Services, or we've been referring to it as the PLS, is available in emergency departments too, and that would be offered to you at your time of visit. All right, we can go to that next slide. So this is a little bit of information on receiving that right care at the right place. So there's been a kind of a poster developed that's been placed in UPCCs and emergency departments alike to help you make a decision on where your care is best provided. Emergency departments are usually in high demand and are very busy, and this can often result in wait times being long. But I want to make sure that I emphasize that if your care is an emergency and it is something that you need care for right away, that emergency department systems are built to provide you that care right away. They're not they don't provide care in a first come, first serve, like you're standing in line at a grocery store and it's just your turn once you get to the cashier. You would speak with a nurse first, or a paramedic would help the team make a decision on how quickly you need care. Those wait times end up being longer when there's inappropriate presentations to the emergency department by members of the general public who may not need to be there. It's all really about who is the best person to provide care in what place and at what time. So I really like this poster. I saw in that it wasn't translated, and I would maybe take inspiration from Luke and his team of translating that other poster. And I would love for a resource like this as a side note to be maybe translated into those other languages as well. But yeah, that's kind of the rundown on the emergency departments. Any questions on emergency care in Canada at all?
There's a note in chat, just also noted, Caitlin, when we're talking about developing resources, that's definitely a poster I can get you to translate. There was a question about ambulance costs. Are they covered by MSP if a person calls 911?
That's a good question. I don't believe it is entirely covered by MSP. I think that there is a small cost that is incurred to the patient depending on the distance from that care. I think it's kilometers based, but I'll be completely honest and I'm not 100% certain about that one.
Is there anyone on the call that can answer that? There's so much knowledge on this call from Interior Health.
I'm pretty sure that you are billed for the ambulance. There is an option when you receive the bill to check off, I'm unable to afford to pay for this. And in that case, it can be covered. So you do receive a bill, but there is sort of a way to get some support if you're not able to actually afford to pay for it.
And they
Thank
would
you, Sarah.
never refuse to transfer you somewhere if it was if you identified that it was something that you were fearful about paying for. That would not become a barrier to you receiving care.
Just to what I see online, Amy, I just did the world's fastest search. It looks like it's about an $80 cost, just to give people an idea. So just wanted to add that to the conversation.
Amazing. Look at us doing all of that in real time. Okay, I am cognizant of time. I need to be the timekeeper too. So Emma, amazing. Keep your questions coming. We'll keep trying to answer them as we go, but we also want to get into all of our teams that are here today. So if we want to move on to the next area, and that's community health services. So we're going to review some specialized services. So as Luke mentioned, when you're entering a primary care site or an urgent primary care center, that's really a gateway to some of the specialized services that you're going to hear about. So not always, you can access these on your own, but quite often that's the route that you'll be connected to some of these specialized services. So I want to turn it over to Saya to review the mental health and substance use specialized services.
Yeah, hi everybody. I'm the team lead for mental health and substance use access team. So I oversee all of the referrals that we get for mental health and substance use services in the central Okanagan. Your doctor can refer you, so your primary care provider can refer you to mental health or substance use services in the community if you are experiencing moderate to severe mental health concerns that impact your ability to function. So they are impacting, you can't work, people have difficulty leaving their home, their relationships are affected. So that moderate to severe anxiety, depression, if your young adult or teenage child is thinking odd thoughts, doesn't make sense, maybe they have some weird beliefs and you're not sure what's happening, go to your family doctor and see if you can get them referred to mental health or substance use services. You also can refer yourself, though, to mental health and substance use. So your family doctor can refer you, but you can also just phone us. And the phone number is on this slide. It's 310 MHSU. That's a regional phone number. So the phone number You can call from anywhere in Interior Health. So if you're in Salmon Arm, Vernon, Kelowna, Kamloops, the whole area, you can call that number and they will direct you to the right city for you. We also have substance misuse counseling. So if you're struggling with drinking too much alcohol or using drugs and you want to talk to a counselor, no, you don't need to use the area code. I just saw that. You just put in 310 MHSU and it directs you where you need to go. These are confidential services. That's important to know because there's a lot of stigma around mental health services. We don't share this information with your family. We don't share it with other people, with your boss, your employer. This is between you and your counselor here. And if you see a physician here, between them. So that's important to know. You can talk to your primary care provider, so your doctor or your nurse practitioner, about more mild or situational mental health concerns that maybe come and go. But for ones that are keeping on going, they keep being a problem for you, definitely come and see us. And we have lots of different services that we provide in the community. I'm just trying to think of what else I needed to talk about. Yeah, that's, I can go to the next slide. There's lots of other mental health resources that are not through Interior Health. So if you're experiencing a crisis and you need to talk to somebody right away, if you're suicidal and you just want to die, call this number. It's right here, 1-888-353-CARE, which is 2273. They're available 24 hours a day, 7 days a week. You'll always get to talk with somebody. There's one other phone number I want to give you as well. It's not on the slide, but it's for all of British Columbia. And I think it's more helpful because you can be anywhere in BC and call it. This phone number is mainly for the Okanagan. So the number is 1-800-SUICIDE. And that's the numbers for it are 1-800-784-2433. So I'll say it again, 1-800-784-2433. And thank you very much for putting that up there. So that's for BC. And that's helpful because you can be anywhere, right? There's also the BC Refugee Mental Health line. And that's up on the screen. There is a BC Refugee Hub mental health toolkit, which is pretty fantastic. And there's also, there's a bounce back program, which is like an online therapy program for people struggling with like really low mood, moderate, mild depression, anxiety, or a lot of stress. If you're going through a lot of stress in your life, which I'm sure you are, then this is a really helpful toolkit. It's delivered online, or they also have phone coaches attached to that, and it's free. So that's important. And then of course, talk to your family doctor. They're the hub for everything. So go to your family doctor for really any health related questions, including mental health or substance use. And that's all I got. Any questions about that?
Thanks. Yeah, I think just, you know, really important to acknowledge that we all have mental health concerns at different times, stressors, situational things going on, and yeah, making sure you're checking in with your family doctor or even at an urgent care center and talking about that there. These services that SEA is leading are really around those more moderate to severe or specialized services. So always have that conversation first, and again, we'll help you navigate to the right service that's best for your needs. So
yeah,
so thanks for that. If there are no questions, we can move on to public health, and I welcome Amanda and Joanne.
I think this is maybe Virginia.
Virginia. Mm-hmm.
Oh, sorry. Go ahead. Sorry, Virginia.
Hi. Yes. Thank you. Thank you. My name is Virginia Bowman. I'm a community integrated care coordinator for the Rutland Public Health Center, but I'm here representing public health in the Interior Health region. And I am presenting from the traditional unceded and ancestral territory of the Sims First Nation in Kelowna. Thank you for having me. So public health focuses on improving health and quality of life among whole populations through promoting good health and wellness, preventing disease and disease transmission, and providing other health interventions. So our programs focus on like you and your children's wellness, which does differ from acute and urgent medical care, which we have been talking about so far. So in British Columbia, immunizations are available to protect children and adults from serious diseases. And of course, we know immunization has saved more lives than any other health intervention. And it is encouraged that all individuals coming to Canada are up to date on all eligible immunization. So immunizations at public health are free and can be provided by public health nurses at local health centers or through school health programs. In addition, some pharmacists are also able to provide immunization for individuals 5 years of age and older. So if you go to a public health center in your area, you'll be greeted by our friendly staff in a confidential and non-judgmental atmosphere. Services you may find at public health center include immunizations, as previously mentioned, and also wellness checks for moms and babies. For example, we can provide a health assessment for those new families and their babies, either in their home or in the clinic, and provide health assessment and share our knowledge regarding how to care for yourself and for your baby. We also offer in-house pregnancy testing. Some locations offer contraception. There are also a variety of parenting groups and nutrition programs and support, and also one-on-one breastfeeding support, just to name a few of our programs. Public health nurses are also connected with each school and are available resource for teachers and families around things like common childhood illnesses, or just getting families connected with the right resources. So for example, public health can link families to our community programs, such as the Nurse Family Partnership, infant and child development, postpartum mental health supports, and resources for living, such as food banks, community groups, community activities. Public health nurses are kind of your link to that. Other services include hearing screening and speech and language services for infants and children. And we also monitor the whole population for communicable diseases and provide appropriate follow-up to support individuals and reduce the negative outcomes of disease and prevent that further transmission of disease. So some of the services do differ in each area. So my key piece of advice is just to call your local public health center and ask to speak with a public health team member for more information.
Thanks, Virginia. And for those that get the slides, all of these are linked to our Interior Health webpage, and there's a link at the end of the presentation where you could enter in any of that as a search in the search and find those services in your area. Excellent. Moving on to Ava and Home and Community Care.
Hi, thanks so much. Hi, my name is Ava. I am an educator for the Home Health Department in the Central Okanagan. Thanks very much for having me today. I'm presenting from the Silks Nation, where I live, learn, and collaborate with my team. So I'd like to briefly talk about our programs within the Central Okanagan and when our programs may be appropriate for you or your loved ones. So the Home and Community Care program services clients age 19 and over, but we often target the frail and or elderly populations with complex medical health care needs. Home and community care helps you to remain independent in your own home for as long as possible. We provide care at home when you would otherwise require admission to hospital or would stay longer in hospital.
We provide assisted living and long-term care services if you can no longer be supported in your home. And we support you and your loved ones if you are nearing the end of your life at home in an assisted living residence or a long-term care home, which includes short stay services such as hospice care or short stay units while you recover from health challenges such as surgery. Next slide, please. Home and community care services provide a range of healthcare and support services for individuals who have acute, chronic, palliative, or rehabilitation healthcare needs. That means if you are struggling for a short-term or a long period of time, home and community care can help. These services are designed to complement and supplement, but not replace, your efforts to care for yourself with the assistance of your family, friends, and your community. Home and community care services can assist you on a short-term basis or a long-term basis, depending on your needs. Next slide, please. The range of services includes community nursing, community rehabilitation, and home support services, as well as adult day services, assisted living, long-term care, and short-term services. These services also include health service assessments, planning and care for adults with developmental disabilities or acquired brain injuries, as well as their families and their caregivers. Like other programs discussed so far, our staff includes nurses, social workers, respiratory therapists, occupational therapists, physiotherapists, rehabilitation assistants, dietitians, community care workers, and speech and language pathologists. Like many other programs discussed, we also have the patient language services available for your assistance. I do have some examples. I think it was the slide before this, sorry. Yes, perfect, thank you. So examples on when you would contact home and community care. So these are a couple examples. Wound care following injury or surgery, home intravenous therapy following an infection, equipment needs and physical therapy following any surgeries, scheduled personal assistance in the home, such as bathing or assistance with falls prevention exercises, assessments and transitions to a higher level of care. So if you or a loved one need to transition to an assisted living facility or a long-term care service, we can provide those assessments. We also provide adult day programs and services in the community, social work support, end-of-life care from nursing, social work, and hospice, respite for caregivers, and case management, in which we advocate, support, guide, and coordinate care for our clients. Next slide, please. Reaching home and community care is easy. As you can see on this number, we do have a 1-800 number, which is 1-800-707-8550, which you can call between the hours of 8 a.m. and 7 p.m. 7 days a week and speak to one of our central intake nurses. Other services, including primary care and urgent care settings, can also complete a referral for you as needed as they see fit. We will then call you for further information in order to provide the most appropriate service for you based on your care needs. Thank you.
Thanks, Ava. There is a question in the chat, and I know there's some sliding scale when it comes to home support and stuff, so maybe you can chat with that. So is home and community care covered by MSP? And I think that's a range, if I'm correct.
Yeah, so it's a great question. So all professional services, so that means nursing service, respiratory therapist, any professional care, you don't need to be in BC for 3 months, which means you're a resident of BC. So generally any subsidized service, you do need to be a BC resident for up to 3 months. But in the situation of a refugee, likely you would be waived from those services. So if it is something you need, I encourage you to reach out, call us, and we can look into it for you.
Eva, can you talk a little bit about home support and some of the costs that are associated with that?
Yeah. So as I said, it's based on finances, home support, because it's a subsidized service. But likely in this situation, there probably wouldn't be much of a cost if you don't have the means to pay for it. Generally, depending on your finances, so depending on your taxes, you have a rate that you pay each day. But there are ways of that being waived if you have income assistance or other means. Generally, once you put in a referral to home and community care, you're assessed by a case manager, and they go through all those pieces for you.
Perfect. So sliding scale, but for the most part, should be covered if you are under a certain sort of income, and we go off that last year's tax or
Yeah,
whatever.
so it's not really a blanket statement. It's depending on your
Yeah.
taxes, but speaking for this population that's asking for this information, I can't really be cut and dry about that, but first step is to call Central Intake. They would look into it for you, and there's other things that they can try and apply for you in order to get the lower cost possible for services to keep you in your home.
Excellent.
Any other questions?
Don't see any in the chat at the moment, but there may be some that pop up. So moving from our sort of elder care and complex medical care to our Healthy from the Start team to talk about care for our young ones. Joanne and I think Amanda now. Sorry for that mix up.
Thank you. Yeah, that's okay. Thank you. Hi, my name is Amanda. I am a regional public health nurse located in Kelowna on the Silks Nation. And Joanna and myself will be speaking about our program, which is called Healthy from the Start. So Healthy from the Start is a telephone-based program for all pregnant individuals, including newcomers in interior health. You would receive a confidential phone call with a public health nurse that is personalized to your questions and your needs. We are available to speak with clients Monday to Friday and some Saturdays between the hours of 9 a.m. and 4 p.m. Are we able to open the links in this presentation?
I think you could. Leave it up to
the
Sabrina,
second one. Yeah, if we could open up the prenatal connections link, then I could kind of give a little bit more information about the referral process.
Is it sharing for you? Are you able to see the screen?
I'm not able to see the site. I can just still see the slide.
Sometimes you have to go to your go to that, sort of leave this slideshow, Sabrina, and hop into that one for us to see it. Yeah, a little tricky, but. You go back to share, you might have a couple of screens up. And if that link comes up, click that one. There we go.
Yeah, so if you could just scroll down a little bit there. So this is our website, which is our web page, which is on the Interior Health website. And so referrals to our program can be made through here from clients. You can see we have our confidential e-form link there, and also by phone, can phone in through our toll-free number, which is also listed there. We also receive referrals through physicians, midwives, community partners as well, but sometimes individuals want to connect with us through the website, so they have that ability as well. So the goal of Healthy from the Start is to offer newly expecting and parenting families timely and free access to information, support, and resources to promote positive health outcomes through the life course. And I'll pass it over to Joanne just to talk a little bit about exactly what we do on those calls.
Hello, I'm Joanne, and I'm in the Tecumlipse-Teysaquepnik nations, which is located in Kamloops. And some of the areas that we cover, we like to connect with families at any stage in their pregnancy to support health and well-being, and that might even include a pregnancy loss as well. Every pregnant individual is offered a one-time phone call to receive prenatal information, and as noted before, there are translation services that we can access as well. That's the nice thing about all of this is, as you can see, definitely the teamwork between all the UPCs and centers. Topics that are covered often include nutrition, emotional health, infant feeding, and preparing for birth and parenthood, and also many other topics that a family might be asking. An email is sent at the end of our call with valuable links to both provincial and our local prenatal resources and community services, such as prenatal classes, the pregnancy outreach programs, food security, and many more resources that are particular to their community. This is a regional program, so we cover all of IH. So whether it's a family located in Williams Lake or in Trail, we have resources available for each of those communities. We also can make referrals, as noted with the other programs, for ongoing support, whether it's requested by a family or one that we identify some needs. So that could be back to KCR, it could be to a UPCC, the urgent primary care, could even be to public health or mental health services and more. So we are a referral-based program as well. The pregnancy and childbirth webpage, as you've got a little glimpse there, provides evidence-based information and resources to support our expectant families. So whether you enter the healthcare system through the UPCC, finding out that you're pregnant, or come straight to the webpage and call us, there's many points of entrance for having support through your pregnancy. Back to Amanda.
Yeah, and I did just notice there was a little comment in the chat there about is there any language services for these services? So all of our interactions are done over the phone. So we do use Provincial Language Services as necessary, with over 200 languages that are available for those. So absolutely, and we do have translated resources that we share as well in our email.
And
So,
sorry, Amanda, I'll
yeah.
add to that as well. For public health also does use translated services, and one of our health centers has a virtual translator service unit on the floor as well for in-clinic. So I think that's up and coming.
Yes, for sure. Seeing definitely more need for that. Yeah, and then as you can see on here, we'll talk just a little bit about Smart Mom. So Smart Mom is kind of a little part of our program that we share. So it's a free prenatal text messaging program, which is intended to increase access to evidence-based pregnancy health information for all families in the interior region. There is supplemental messages that you can sign up for, which include for newcomers as well, with some good links. So yeah, that is it. Any questions?
Excellent. We can probably go back to the main slides as we're checking the chat box. I think we've answered. I'm really happy to hear that, just the responsiveness around translation services and everybody just being really aware of that, supportive of that. That's great. Thank you for that. I think we can move forward and we'll answer questions as they come. Yeah, and I might lean on my health and public health colleagues a little bit for some of these next two slides as well. But I guess there were questions from the communities just around dental care and vision care, and fair enough. We did mention earlier in the presentation that things like dental care, glasses, contact lenses are likely extra costs that aren't covered by MSP. There's some links here around reduced cost clinics and not-for-profit dental clinics, actually across the province. So thanks to Shelley Boyle, one of our nurses in primary care, who found those resources for us. There's the LIFT program that Interior Health provides for families. So it's a free dental program offered at public health centers for children 0 to 4 by appointment only. Does anybody want to take that briefly, or we can just leave the link? No takers, that's totally fine. I think it's just some dental education for the young ones. So just proper brushing and care. So not dental hygiene services or dental services, but some more education and coaching. And then there's the BC Healthy Kids program, which provides basic dental treatment, optical care, and hearing assistance for children up to 19 years old for low-income families not receiving income assistance. So that might be a good link to check out as well for some of those other services. I think the next slide is good to go around vision care. So as I mentioned, most vision products you will have to pay for. MSP does cover eye exams, so they're free for ages 0 to 18 and for seniors 65 plus. That's covered under MSP. For ages 19 to 65, however, medically required only eye exams are covered through MSP. So just be aware of some of those different stipulations there. Okay, I think we're going to move on to resources now. We're winding down. And so just wanted to review some important resources that you can access at any time. And this one being 811, so HealthLink BC. You can call or access it via the web. By calling 811, you can speak to a health services navigator who helps you find health information and services or connects you with a registered nurse, a registered dietitian, or an exercise professional, or even a pharmacist. And absolutely, translation services are available. There's even a lot of resources on HealthLink BC that are already translated, general health documents and things like that. I personally have used this service as a young mom who, you have a baby, it's 2 in the morning and there's a rash or a fever. You can phone and the nurse walks you through sort of what the presentation might be or whatnot. So it's a great service, 24 hours a day, 7 days a week. I think someone mentioned in the chat it's free. Yes, absolutely. Another service is bc211.ca. So it's a sort of a fairly new web service that is more around supporting you to find community services or social service organizations, cultural services. So it's a huge database in that regard. So just some good resources if you're unsure. And I think in some of our healthcare posters too, it's on there. So call 811 if you're unsure of where to go. They'll also help you if you need to go to emergency now, or this can wait to see your doctor in the morning. Yeah, that's a provincial service. So, okay, I think we're wrapping up now. If we go to these final 2 slides, so you'll have this in your resource package. We left a lot of links for you in case they didn't. So it's all in a bit of a library for you. You go to the next slide. We've added some more resource links around some different things. So those that not-for-profit dental clinics, Provincial Language Services, and some videos on just a resettlement to Canada as well. We added in there. So yeah, that was a lot of information for everyone on the call. I can appreciate that. I think it was definitely beneficial to me, and I see a lot of my colleagues sort of tuning into that as well. So I just want to appreciate and acknowledge everyone's time. Thank you for taking the time and being part of this really important project. I appreciate it. Caitlin, did you want to say any last words?
Yeah, I just wanted to say thank you to everyone for attending. Thank you to all of our amazing presenters for sharing your wealth of knowledge. I think it's really important for those working with newcomers to Canada, also newcomers to Canada coming themselves, to really be able to understand how to best access the services that are available to them in the community. In fact, it's good for everyone in the community to know this information. And so we really appreciate the time you've taken to be able to come and share with us today. And just to reiterate, we will make sure that all of these resources and more are shared on the website. I've put the website in the chat for you. It's kcr.ca/RRT, and there will be all of these resources around health and how to access the health system, but we will also be including many other resources there. Some are there and we continue to add to it, or you can also add to it if you think there's something missing that could be benefited from. So yeah, just thank you very much. We really appreciate it. And thank you, Amy, for co-hosting with me. Really greatly appreciate that.
We did it. We'll leave the chat open for a minute or two in case any questions roll in. And yes, I want to also reiterate thanks to Pamela and Grouse for the welcome today and the opening prayer. So thank you. I think I'm reflecting as a transformation lead that this work is really happening. We're all connecting. That's really what I noticed today. Everyone was aware of everyone's programs, and that if you enter one door, we're going to help you get to the right place at the right time. So that was really nice for me to hear from these widespread programs today. All right.
Any last chance for questions?
On behalf of a client, are there any options for medical coverage while waiting for the 3-month waiting period for MSP?
Jennifer, can you give us more information about what immigration stream this individual might be coming from? Because if they come either through any of the refugee streams, they would be hopefully signed up for Interim Federal Health, which would give them access prior to MSP coming. They're on a work permit, a QIT work permit, or a different work permit. Because if they're coming on a QIT work permit, they are now also eligible on day 1 when they arrive. A spousal work permit. I am not aware of anything. I don't know if any of you from Interior Health are aware of anything. It may be a situation where travel insurance may be able to be purchased for that 3-month time period, to ensure that if there's any need for those supports that they can access those. Anything to add to that anyone knows?
That might be one for us to take away. That might be a unique case that we'd have to look at. I see a hand up. I do want to, there was a question about the premium assistance. I did provide that link in the chat. You just click on that and you would get your information around the premium assistance. Sorry, Caitlin, go ahead.
No, don't be sorry. That's perfect. Premium assistance typically is again on that slide on the scale regarding income. So it depends on your income as to whether or not you would be eligible. Correct, Amy?
Yes, that's correct. And I believe there's more information in that link.
Okay.
2 hands up.
Great. Do you want to start, Min?
Hi, yes, sorry.
That's
I
okay.
just have a quick question. So like for temporary foreign workers with a closed work permit, right? Let's say that if they apply for the MSP, but during the wait period of time, while they apply, so they usually get a reference letter, right? With the reference number saying that you submitted the application. However, in the meantime, they haven't, before they receive the MSP card, if they had to go to the emergency, would that be reimbursed? Would the fee be reimbursed later?
Sorry, just to clarify, you're asking if they have already applied for MSP but are just waiting for their card to come?
Yeah.
Okay. I have an idea, Amy, but I think I better let you answer that one.
I'm looking at people like Emma. So I don't think we would turn a person away for emergency care. Sorry, Emma, you've come off mute, so you're probably better positioned to answer.
And I will fully admit to frantically Googling while those questions were being asked. But my understanding is that 3-month waiting period is not retroactively kind of provided. Any care that you receive within that 3-month period is still billed to the individual. And then any benefits on top of that, I'm not sure of what that coverage looks like, but I'm pretty certain for basic MSP coverage, it's unfortunate that that 3-month waiting period, it's out of pocket.
Now, Emma, if you finish the 3 months, but you have applied, but you haven't received your card yet, that potentially could be covered. Is
I
that
believe
correct?
so. Yeah, I believe that can be, as long as that 3-month waiting period has passed, I believe that everything is covered up after that 3 months.
Thank you, Emma.
Yeah, Min, you had a follow-up?
Just an extension to that question is what if this temporary phone workers with closed work permit, they were previously living in British Columbia and they moved to another province. Now they have moved back to BC. Do they have to reapply for MSP, or do they just activate their account and they can have that instantaneously, the service coverage, or not? Or they still have to wait another 3 months?
I think it depends on the time frame that they were out of BC. I think that is dependent, and for what reason they left BC.
And they moved to another, sorry for cutting you off, sorry.
That's okay.
So they moved to another province for work, probably for half a year. And they decided they finished the job there. They want to move back to BC. They're currently in BC, but they're not sure if the coverage happens right away or not.
Yeah, I think it does depend on how long and for what reason they've been out of BC. I've tried to find information on the website here, but I will note that they do list a 1-800 number for help for anything MSP related. I'm going to put that phone number in the chat just so folks have that to access, as they would be the best person to ask questions about MSP about for sure.
Yeah, sure. No problem. Thank you
very much, Emma.
Thank you.
Yeah, I agree. We may be subject matter experts in our certain programs, but not the ins and outs of everything around MSP. So I really appreciate your input. And I see Shelley's probably frantically Googling somewhere too. So we'll try to find that information. Sebastian, your hand's been up.
Thank you. Yes, I just put a note in the chat. I advocate for nationals, particularly international students, but quite a few groups of foreign nationals to that number here at the Medical Services Plan team. For health insurance, British Columbia, I have spoken with them on a number of occasions and I've confirmed protocol, policy, procedure, those type of things. I just wanted to speak to Jennifer Pratsky's comment as well. Apologies if I mispronounced your last name. But more generally speaking, for those temporary foreign nationals who are coming into Canada and are trying to satisfy the coverage wait period of 3 months, or the balance of the month that you arrive, plus an additional 2 months, I would be careful looking at distinctions between temporary basic personal health insurance rather than extended health insurance. And that travel insurance often can cover emergency services, but in many instances, there are quite a few exclusions, specifically as they relate to pre-existing conditions and a few other items. And then also speaking to the most recent comment about someone leaving the province of British Columbia, would say when you are calling the representative or the agent from Health Insurance British Columbia to make mention to whether or not that particular client or individual had specifically mentioned that they'll be leaving BC permanently as part of their application. There's a specific process for this. And afterwards, there isn't really a statutory period of time where coverage will essentially lapse and then you'll have to re-complete the coverage wait period, but it's done in a bit of a case-by-case basis, depending on the reason you left the province. There's an additional form in process. But I'd follow up on the Interior Health website for that as well. Just wanted to provide some clarification on that, just based on my own expertise.
I think we needed you as a speaker on this panel, Sebastian. So that's noted for the next one. And maybe you can exchange information or reach out to Sebastian, who sounds like an expert. Thank you.
Thank you. I'll put my information in the chat. Thank you.
Any last questions? No, it's been a fantastic conversation. So thank you very much for all your great questions. Any questions from the Interior Health crew? No, looking good. All right, look, we gave you 7 minutes of your day back. Thank you again for joining. Amy, do you have any final thoughts?
Just thanks, everyone. Appreciate it.
Thank you very much. Have a great rest of your day. And thank you again for joining us.
That's great.
Thank you, everyone. Have a good day.
Thank you.
Great job, KCR team. Signing off. Bye-bye.
Thanks, Amy. Take care. You too.
Thank you.